Hello, this is Daniel with Clarify. This training is specifically in regards to our new form. The public health response to COVID-19 depends on comprehensive laboratory testing data. To comply with the CDC's critical mandate, our lab must require additional information for all COVID-19 tests. We would ask that effective immediately that this new updated form be the only form in use at your facility. I'm going to walk you through a few demos that we've created. This is our updated form. As you can see, it's very similar to our previous form with just a few minor updates. I want to point out that if you have any questions at all, you can call or text this number and we'd be happy to help. I also want to point out here that we do require that you fax or securely email this form filled out in its entirety, a face sheet and provider order for every sample that you send to the laboratory to this fax or this secure email. Doing so will help you to get your results quicker, and not doing so could actually cause major delays in you getting your reports back. I have two demos that I'm going to review with you. The first is a resident demo, and the second is a staff demo. On the resident demo, the first section would be for the facility information. You'd write your facility name here, phone number and fax. If the individual or the patient being tested has a home health agency that they're working with, you could write that name here, and you could write their fax number here. And if they would like a copy of the report, we'd be happy to fax it to them. The order and provider here, and again, phone number and fax. For the patient information, we ask that you do use legal last name and first name as it would be on a government issued ID. So last name here, first name here, gender, date of birth, phone number, last four of the social, current address, and the county in which they reside. We understand from many of your residents that that address, phone number would be the address and phone number of the assisted living facility or any other facility they may be at. So please feel free to write that information here. The next section is for insurance information. You would write the insurance plan name here and the policy number here. The next section is for diagnostic codes. You'd write any and all applicable diagnostic codes in this section here. And then the next section is for PCR specimen information. We're not going to review this in depth, but we would love to do an additional training where we can go through the advantages of doing PCR testing over standard culture and sensitivity testing for urinary tract infection, gastrointestinal, open wound, nail and paronychia, urogenital, ophthalmology, and otolaryngology. For this individual, we're going to go to the respiratory and COVID-19 specific section. As you can see, there's two sections here. One is for the patient and resident only, and the other is for staff only. For this individual, it was marked that they were symptomatic, so they're doing a full respiratory menu in addition to COVID-19, and they did this with a nasopharynx swab. The major advantage in doing a full respiratory menu with COVID-19 is that if they are negative for COVID-19, but they're sick, it's important to know what they do have so that you can get them on a treatment plan so they get better as quickly as possible. I do also want to point out that if they're symptomatic and you have other areas of concern, such as a sore throat or heavy sputum, you're welcome to do all three collections and put those all into the same PCR tube. The next section here is for staff only, and we'll review that in the staff demo. For this individual, they were symptomatic, and so their symptoms were marked here as fever and shortness in breath. And you can also see that those associated diagnostic codes are listed here. One of the new additions to the form is date of symptom onset. So you'd put the date that the symptom started here. For this individual, it was marked that they had suspected contact with a person with COVID-19, and that associated diagnostic code is here. And then in this section, you can see these are additional questions that are required and mandated by the CDC. The first one is, does the patient identify their race as, this is marked as Caucasian, does the patient identify their ethnicity as not Hispanic or Latino? Is this the patient's first COVID-19 test? Yes. Is the patient currently hospitalized? No. Is the patient currently in ICU? No. Is the patient pregnant? No. Is the patient a resident in a congregate care facility? Yes. Does the patient work in healthcare? No. And then finally, you'd write the collection date and time, as well as who actually collected the specimen. So who did the nasopharynx swab for this individual? The next part would be the staff demo. As you can tell, it's very similar. But for this individual, of course, you'd write the facility name here. This individual, being that their staff would not be affiliated with a home health agency, so we wrote not applicable. And then you would have the order and provider's name here. Being that we are using a commercial laboratory for this testing, they do require that every sample sent be accompanied with a doctor order. And so it is important to have the doctor's name on the form. You would put, again, legal last name, first name here, gender, date of birth, phone number, last four of the social security number, current address, and the county in which they reside. You would also put any applicable insurance information here. For this individual, it was marked Regions Blue Cross Blue Shield, policy number, and the group number. If the staff member does not have insurance, you would simply write no insurance in this spot right here. Any applicable diagnostic codes, including the Z11.59, which is and includes surveillance or mandatory testing for COVID-19. Again, we're going to skip this section here. This is specifically for COVID-19. Again, this is not a patient or resident, this is a staff. And so they are marking only COVID-19 test. The nasopharynx swab is marked here. This individual is not symptomatic, so they wrote not applicable in both spots here. For exposure, this individual is marked as known contact with a person with COVID-19, and that diagnostic code is marked here. For additional questions, does the patient identify their race as and was marked Black or African American? Does the patient identify their ethnicity as not Hispanic or Latino? Is this the patient's first COVID-19 test? No. Is the patient currently hospitalized? No. Is the patient currently in ICU? No. Is the patient pregnant? Yes. Is the patient a resident in a congregate care facility? No. Does the patient work in healthcare? Yes. And as above, you would write the collection date, time, and then the collector, whoever did the nasopharynx swab for this individual. Again, I cannot stress enough the importance for you to know we're here to support you however we can. If you have any questions or need anything at all, please do not hesitate to reach out to us. Thank you so much.